Hey, welcome to another episode of Dental Assistant Nerds. Today's episode is actually brought to you by one of our sponsors, Elizabeth Wickham, DDS. She's located in Washington, Pennsylvania. So if you're looking for a new dentist in the area, just outside of Pittsburgh, maybe you're actually looking for employment. They are a supportive office. They've actually sponsored a few students to come through our program. By all means, look them up. You can find them on North Main Street in Washington, Pennsylvania, and you can contact them at 724-225-5070. So, with that being said, we're going to start the episode here today. I'm one of your co-hosts, John, and of course, we have the lovely Amanda with us.
Hello, everyone. Welcome.
Welcome, Amanda. It's always good to see you. Thanks for joining us today.
Absolutely. It's a beautiful sunny day here in Pennsylvania. Of course, we're always brainstorming what we're going to talk about, hot topics that we see on social media, things that we've brainstormed and been experienced with over the last 20 and 28 years of our careers. It's always potentially of controversial of opinion. But
Well, this sounds
uh,
this sounds very spicy.
Today we're talking about being on the job train, going to a dental assistant school, in the dental assistant program, whether it's a short-term program such as what we offer at Cornerstone Dental Assistant Academy, or going to a long-term program, typically 10 to 12 months, so around a year. So what do we choose? We always hear a huge controversy of opinion across social media. Of course, we've worked with every avenue of dental assistant in our career paths as well. So what do we choose, and why would we choose one direction or the other, right?
Yeah, I mean, we get those questions even from potential candidates that want to apply at our school. It's typically like, why should I come to your school versus dentist Dr. Smith over here is willing to train me for free. He tells me I need no school, and then you have a big school that's long term, which obviously is enticing because you're like, okay, how are these other people teaching me in 13 weeks? But what do I do? That's the question we get in person, and of course that's the kind of the questions you see online. So I think that's a great topic we're going to talk about today. So Amanda, what do you think? Let's say a young Amanda gets out of high school and she's like, hey, what should I do? I'm looking at all these different options. Dr. Smith's offering to train me on the job. The short-term program, very affordable. It's very fast, accelerated. And then, of course, you have this long-term program where I'm going to be going to school Monday through Friday, Monday through Thursday, taking up all my time. And of course, you have the student debt that goes with it. So, what do we think of that?
I think as an overall quick perspective, you have to do what's right for you. You have to break down the pros and cons, and we're going to help you do that in this podcast today. And of course, give our side in the sense of opinion of what some of those pros and cons are. And if you feel you need that extra time as a long-term program, then you should do that. If you want to do the short-term program because you feel like you can handle things in an accelerated manner, then you should do that. On the job train in the state of Pennsylvania, which is where we are, you do not need an education in order to obtain a dental assistant position. And over our years as well, being a dental assistants ourselves, we've also been those assistants that were in charge, or the one that was handed over that person of, hello, Amanda, thanks for coming to work today. Hello, John. Here, nice to meet you, Sarah. Sarah's an on-the-job trained assistant, and you're in charge of teaching her what she needs to know, right?
Yeah, yeah, remember that ad that I ran a couple weeks ago about, hey, we offer on-the-job training? Well, good news. Here's Sarah.
Yeah. So is on the job training acceptable? Sure. The biggest thing, and of course, now as educators ourselves, and John and I both went to school as well, so neither of us were on the job trained, that on the job trained individuals will only learn what that office teaches you, right? That's the biggest downfall of that being on the job train. that they're teaching you repetitive motions of dentistry, and dentistry in most professions are very repetitive. That once you learn how to do a restorative procedure such as a composite resin, an amalgam, and an extraction, and you know what order that doctor wants that product or wants that instrument, you're able to go through your day, right? You're able to go through your day about sterilization, but you don't understand the why. So that is John and I's biggest component, that when we have students ask us, why shouldn't I be on the job train, or why should I go to an education program, that an education program versus whether it's short term or long term is going to teach you why you're doing something. You're going to know why the etchant is used and what it does to the tooth, versus on the job train assistant, you might just be told, hand me that blue syringe or purple or pink or whatever color your etchant is. Now, I'm not saying across the board that some offices don't go above and beyond and teach you the why. Of course, there's offices that are out there that do so, and that's great. But a lot of us, when we are getting an on-the-job trained dental assistant, is that we're so busy that as an office, do we really have a plan of how to properly and thoroughly on the job train that person? That would be my question, as if I'm going into an office with someone with no background, with no knowledge, and that yes, you're willing to train me. My question would be, how do you plan to train me?
Yeah, what's the
Is it,
plan?
what's the plan? Do you have a plan set up? Because of course we, we are seeing these offices that are popping up and they're saying, come to us, we have an on the job train plan as an assistant when we hire you with no experience. But typically you're not pulled into, the office setting with an office manager or a lead dental assistant, and they're going through tooth numbers, they're going over tooth surfaces, they're going over proper sterilization techniques. It's typically, in our experience, and many assistants that we've talked to naturally and worked with over the years, that yeah, wing it on in,
Oh
whatever
man,
you,
is it a crash course? It's like
yeah.
how many times, Amanda, have we talked to someone and they typically say they get there, drop your stuff, hey, we're doing a DO on number 14. And you're like, wait, what? You
And
know?
you're an on-the-job trained dental assistant. You have no idea where number
Right.
14 is, and
Yeah.
you're doing a do, a
Yeah.
do, a do. You have no idea what do means.
Yeah.
And you have no idea what a distal or an occlusal means either if you're saying the words.
Right. And obviously, people that went to school so long ago, they seem to forget how hard it was for them to learn those things that, hey, I'm just going to go ahead and advertise. I can train anybody. And this is really easy. And obviously, you get those people that it's an immediate crash and burn because, you have someone that's, hey, I'm pumped. I'm getting offered on the job training. It's free, and they get in there and it's just so overwhelming. I could never imagine walking into an office and all of a sudden someone speaking this other language.
No, I can't either. And it's just part of course, dentistry and any new profession that you walked into is challenging. Whether it's dentistry, it's nursing, no matter what it is, that there's an overhead it's just overwhelming and it's challenging and it's intimidating. So no matter if you go through an education program, short term or long term, it's still intimidating to step into the office and also have this abundance of knowledge that you're taking with you, but there's always still a ton to learn. Over the course of your career, there's still going to be a lot to learn to get comfortable. And it takes months, and that's a whole other podcast in a sense of dentists and hygienists and office managers forgetting that there was a period of time that we were not comfortable with what we were doing. So it does take time. And even as an experienced dental assistant myself, that if I choose, a different location to go to a different office, it takes time to learn that office. So on the job train versus an education, yet again, do what works for you. But remember that when you're an on the job train assistant and then you go to your next office, your doctor retires, it's time to move on for whatever reason, that you're only taking that knowledge with you with what they trained you on. So there's this whole other world of education of maybe why procedures are done differently that you may have learned in your education program, but being you didn't go through an education program, you're not taking that knowledge with you.
Yeah, and for us being here in Pittsburgh, you know, what year did you start, Amanda?
2002.
All right. So would you say when you first started that the majority of doctors in this area were kind of like from either West Virginia or Pitt?
Yes.
So, we've had this influx of Pittsburgh being kind of like a melting pot of all these dentists coming in from all over the country because now we offer these different residency programs. Pitt is one of the leaders in the country as far as taking foreign trained dentists. And guess what? These people that come here, they stay. And
Yes.
now you have someone that maybe did, a dental program and they decide to go back. And now you have all these different training facets of Texas, Arizona, Florida.
Right.
And now it's like what we were initially accustomed to in our early on in our careers, that's not the case. And
Mm-mm.
unfortunately, if you're learning from Dr. X from school at Y, and now all of a sudden that's all you're not you didn't learn that broad basic knowledge, and now you're going to this other doctor. Unfortunately, this doctor went to a different school. He has a whole different technique, whole different products. And this is where it gets frustrating because now we see in groups, hey, I worked for this doctor for 2 years. I got hired at this rate, and this doctor is insulting me saying that there's no way I have 2 years experience because I should be so much further along. And going back to, does everyone really remember what it was like when you first started in office? How difficult it is to pick up the flow of the office, let alone the materials. It's very difficult. So within 1 week, um, you know, whether you're coming from an accelerated program or whether you're coming from the background training of a long-term program, it's like now you're trying to put all that into, hey, I'm trying to work in a brand new office. Imagine now you at least have a broad-based knowledge, but imagine now you only know one way because you were only trained by one dentist. Imagine coming into that. And we've actually had a few students who've enrolled in our programs that they worked for offices 6 months, 2 years, 4 years, and their doctor retired, and they were like, "Hey, I'm in
Right.
way over my head, and I need help." Right.
Yes.
So, that's definitely something that you want to think about whenever you're contemplating exactly what to do. So,
Absolutely.
and then I think you know what I mean? I think this is a great time for a break before we really get into the meat of the conversation. What do you think?
Sounds good.
All right, perfect. So we're gonna pause for a break. So just here's a quick word from this episode's sponsor. All right, and we're back. Welcome back to the episode of Dental Assistant Nerds podcast. Amanda and I were just talking about some good stuff here. Amanda, you want to share
So
with us?
So we're talking about on-the-job train, attending a short-term program or attending a long-term program for an education to become a dental assistant, and what is the decisions and the pros and the cons, of course, of what would take you in each direction. We're in the state of Pennsylvania. On-the-job train is an option here. So if you're not sure, if you're not a dental assistant and you're listening to this, a great way to find out what your state regulations are on danby.org. And you can go to your state and then you can see the list of what criterias are for your state in order to maybe determine what education direction you should go. Uh, with that said, of course, John and I are instructors at Cornerstone Dental Assistant Academy. We teach a short-term dental assistant program here in Pennsylvania, but we also went through a dental assistant education program. I attended personally a long-term program, which was a year. So the biggest, there's a lot of big things. There's a lot of goals. I always say that, and there's so many, in a sense, bullet points of the deciding factor. One of the questions that I would be asking myself if I was on the other end and I was deciding whether I go through short-term program, long-term program, on the job train. Of course, if you're on the job train, you are typically being trained by a dental assistant, which is great because they understand the profession of what you're about to embark on. But there are times, unfortunately, that short-term programs, especially, and long-term programs, I guess, that you want to ask or keep in the back of your mind at least, depending on how maybe upfront you are with how you can kind of confront somebody, is the person in front of you that is the instructor or teacher teaching you the trade, such as a dental assistant, is that instructor or teacher also a dental assistant? Or have they worked as a dental assistant in the past? Do they have some knowledge in dentistry? Because they're teaching you how to be a dental assistant. To me, that seems like a no-brainer question. But on the
And
other
to
side
me,
of that,
I would think that that's actually what a school would require and a Department of Education would require, but we found out that's not the case, right, Amanda? So I'm sorry for jumping in there, but it
right,
just blows my mind, right?
that's not the case. So of course, John and I have definitely not done 100% research in every dental program across the country. That's not the case. There's many programs out there. But if you're listening to this, no matter where you are, state of Pennsylvania or outside of Pennsylvania, it would be something that I would question. That is the person in front of me having a background in what they're about to teach me about. That's one of the things that John and I are proudful as Cornerstone Dental Assistant Academy, that we're instructors. And of course, we have that knowledge. So we're teaching dental assistants to be dental assistants. And there's times though that you're going to have an instructor that maybe is a medical assistant or maybe has a bachelor's degree in teaching, but has no knowledge in dentistry, or has a some sort of degree in, I don't know, economics, or it can be anything. You know, a long-term program, college, university style education could potentially require a bachelor's degree, but a bachelor's degree in what? But a short-term program as well, that they have a dental assistant program, but someone has knowledge in phlebotomy or business, or so they're handed a curriculum and they're handed a book and say, congratulations, Sarah, you got the job to teach a dental assistant course. Now here's the curriculum that you're going to be teaching, so learn the curriculum to teach it to the students. So
Yeah, so now they're just reading a book, they're that person standing in class just reading a book that you could essentially do, but now you're paying for this education and you're getting someone that doesn't understand the aspects of it. They're basically learning as you're going too.
absolutely. So, if they've never stepped into a dental office and experienced what the profession is and the career is as a dental assistant, then you're not, by any means are you saying you're not going to receive the education that you need, because you're going to be, I hope you're going to learn something along the way, of course, of obtaining a dental assistant position. But one great thing about someone who works as a dental assistant and then is teaching you is that you're going to get this whole side of experience as well. And not that we just share personable experiences. That's not the case at all. We also teach, from the Modern Dental Assistant textbook, which is an approved book through Danby, the radiology textbooks that Danby bases their radiology health and safety Danby exam through. So, the curriculum is based off of those textbooks, but you're able to get these real life experiences and an understanding of what really a doctor or a staff or an office is expecting of you as a dental assistant. Um, to rewind a little bit, as an on-the-job trained dental assistant, is that if you have, you know, Linda, who was on the job trained, and then she, on the job trains Sally, Karen, and Jessica, and, Amanda. But, let's just say, for instance, that how Linda learned was what if Linda learned the wrong way? That, let's just use the sterilization bags for an example. That the sterilization bags have the perforated line that by rule and for proper sterilization technique for your instruments, that first of all, the bag's not overstuffed. There's room between instruments, and that perforated dotted line is the line in order for the sterilization bag to work properly in your autoclave, not, put a small instrument into a large bag and it's completely folded over and you have this big bubble in real terms. That's not a proper bag that's closed properly. But if Linda didn't know that, and she just taught the other 5 assistants over the course of the last 5 years as well, the wrong way, then now everybody's teaching someone else also the wrong way. So you can also, so me saying that, you can see where that ripple effect happens. Well, this is how Linda taught me. Well, Linda also got taught wrong. So that's where this education program comes into play, that the on-the-job train can be that ripple effect of being wrongdoings, when the education program is going to give you, hopefully, the correct way. Sterilization bags should not be reused. You don't leave the seal open and reuse the bag. Saliva ejectors and HVEs and air water syringes that are plastic are one-time use. They're not to be soaked in bleach water and or cold
So
sterilization and
you're
reused.
telling me that I shouldn't put instruments in a sterilization bag, run them, and then when the cycle's done, open a drawer and dump them out like my silverware drawer at home? Is that what you're telling me?
I am telling you that is wrong.
But it says clean on the drawer.
It does say clean on the drawer.
Yeah,
You
and
get an OSHA inspection and your instruments are not in the bag, you're getting in trouble for that. Every
it
instrument
says
should be in a
clean.
bag.
That's how Linda taught me.
Yeah. And just because the XCP X-ray holder, the bar, and assistants will say the bar doesn't go in the patient's mouth, and neither does the ring, so we just wipe it off with a cavi wipe. That's a big old double thumbs down. That's not right.
I love when people just start, thinking outside the box, that like they know more than, our good friends at OSAP and all these other studies that have been done. It's like, what's the big deal? Even with you're talking about the sterilization pouches. I mean, you see the argument of, well, what's the difference if I put it in paper up or paper down? Like it's still work. I don't understand what the big deal is between the plastic and the paper. And it's like, a lot of times it's dentists actually putting that in the comments, and it's just it's funny because they're like, hey, we're doctors, but oh, by the way, we're not going to trust proper sterilization and infection control techniques.
Yeah, so with that said, if you're not sure if it's paper up or paper down, we also say read your manual. Don't throw away the manual to the autoclave, and see if it is paper up, paper down. That M11 autoclave sold is probably one of the most popular autoclaves. So each tray should be consistently the same. Each tray should not be overpacked. So there's all these things to go through of an education program should be covering why these things are important. Our first group, our current class of students just started class last Friday. We had a great group of 10 join us at Cornerstone for the next 13 weeks. So two of the sort of what we would consider basic tasks as dental assistants that we cover in our education program was we hand a syringe with a needle and a corpule to a student. And I handed it over to a student last week as I was just going to pretend expecting her to put that together. And she's like, I have no idea what to do with this. I don't know how to properly put this together. That's exactly my point. So I'm going to be here to teach you how to properly put the syringe together and the carpio together, which of course someone's going to, in a sense, listen to this and think like, oh, how simple. It is simple. It is simple once you're taught properly how to do the scoop method to re-tap your needle, or to use the metal TP to turn your needle upside down. Or the overall goal of this is to prevent a needle stick, right? If you're, in
Let's hope
class,
so.
we're not obviously giving injections to each other, so we're not dealing with dirty needles. So thank goodness that if someone would potentially have a needle stick, that it's with a clean needle. There's no chance of cross-contamination with disease. But if you as an on-the-job train are expected to just hey, we're busy today. Sorry, we're not going to get to your training. And you're just going to help me along and take this tray and put it in the ultrasonic solution and take that syringe apart, you're going to be lost. It's the same thing as putting a friction grip burr into a high speed handpieces versus the latch burr into a slow speed handpiece. If you don't, if you send your on the job trained dental assistant now 3 days in with no proper training and you say, oh, go get me a friction grip size 8, what? No, what is he talking about? You're going to somebody asking for help because you have no idea what a friction grip size 8 burr is, or even what friction grip means.
Yeah.
So it's,
And that's a great point that, what happens whenever someone gets on a job train and you're busy, right? You're thinking, okay, what is the one task I can put this person at that they're basically going to be out of my way, but yet they're still helping me. I know the last couple of times I've had been, Sarah's come to my office. It's, hey, I can show this person how to do this in 5 minutes, and this is kind of where I'm going to leave them at. And then if I get more time, I'll show them a little bit more. But now, hey, I might come back when I have more time. Next thing you know, it's a week, it's 2 weeks, and that person is still doing that exact same job because unfortunately, that's what you have time for.
Yeah.
And,
Yeah.
we're busier than ever in dentistry. So I couldn't imagine these offices now that are offering on the job training. Like, how's that going?
Yeah, so I think in retrospect, if you are choosing an on-the-job train position, it's great in that in the sense that an office is going to take you under their wing and help you. In some states like Pennsylvania, you still have to study to take that radiology health and safety course in order to be X-ray certified, and take that exam through Danby. So there's still some, in the sense, they're also going to say, oh, we'll on-the-job train you, but in 6 months, will you take this radiology exam? So if you open up that radiology book and start reading the dental terminology that's in that book, when you've had no on-the-job proper training as a dental assistant, you're going to be like, I'm never going to pass this. I mean, of course, students, individuals do, but there's a lot to learn when you don't, and when that book is talking about teeth, when you don't even know teeth numbers because they're just letting you wipe down rooms. And wipe down rooms is more than just using a Clorox wipe or, your mop bucket that you would use at home to clean a bathroom, maybe.
Grabbing that alcohol gauze and making things happen.
Yeah. So, there's just a reason behind everything that you're doing as a dental assistant. We are in a healthcare facility. We are exposed to disease. We are exposed to COVID, flu, HIV, hepatitis, TB, all these transmittable diseases that we know that as long as we treat everybody the same with universal precautions, that we are protecting ourselves. But the person that's coming in with no experience and they've not been told to take out that saliva ejector out of your holder and to wipe off the saliva ejector insert and then wipe down the hose and wipe the holder that it sits in, and why your dirty gloves are on that handle and then you put it into its home, that now the home is dirty, now the holder is dirty, so you don't want to just wipe off and not take everything out of those holders. So just small things that seem so superficial, non-important to those in the sense of us as well that have just done it so long and so many years that you sort of become robots and you go through the motions. But those are the things that if we don't properly teach our on-the-job trained dental assistants, that why, maybe that education program would be more beneficial to you. Of course, being educators ourselves, going through an education process ourselves as well, many years ago. Of course, we're always going to promote the education side of it. But there's also a financial end of the well that is a huge difference between an accelerated program and a long-term program as well.
Yeah, I mean, I think we've gone over a lot of great points today. Anything you want to add for the wrap up here? Of course, if you do have questions, maybe something's not crystal clear to you, you can always email us at cornerstonedainstructors@gmail.com. Feel free to hit us up there. Just let us know, that you found us on the Dental Assistant Nerds podcast, and, we'll help you out as best we can. But we'll see what other topics we can come up with, and hopefully catch us on the next episode. You can always find us on Spotify, YouTube, and of course the Dental Assistant Nerds podcast page on Facebook. Amanda's going to send us off with the most positive way she knows how.
Yeah, so as dental assistants, as employers, as if you're not in the dental field and you're listening to this, stand tall, stand out, be the difference in whatever profession that you're in, be the person that you want the person beside to you to be as well. Be confident in the knowledge that you have gained. Continue to keep your mind open and continue learning, as our career field in dentistry is always changing. The world is always changing. So, be kind to one another and have a great day. And we hope that we can help you and guide you on this process and whichever you choose.
Yeah, absolutely. And like I said, just keep an eye out for the next episode, and we will be getting back to you guys soon. Have a great day.